Thank you all so much. I'm so excited to be here to talk about one of my favorite topics in DPC, and that is sustainable success. We're calling it today. Say that 5 times fast. And I have the challenge of keeping you excited before lunch. So work with me. We're going to make this a really good time. We're talking about creating balance between your DPC and your home. This is one of the questions I am asked about so much by medical students, by residents that are interested in DPC, by established attending physicians in the insurance-based system that are thinking about joining DPC and joining our amazing movement, but they're concerned about how does the balance look? How does the work-life balance look? They have your cell phone number. What does that look like? So I believe that I have really found a way that has worked so well for me and my family, and I'm excited to share some of those things with you today. Because this is about lifestyle and home life and work-life balance, I would have to start the about me by sharing a little bit about me and my family. Since Carlos and I, my husband, we just celebrated our 8-year anniversary, I thought it'd be appropriate. Thank you. We're headed to Mexico on an anniversary trip after this, so shout out to you guys for the conference. Tag on a vacation on there, but I thought I'd put my wedding picture on there. So huge support. I mean, the spouses of DPC are the real MVPs. Shout out to any DPC spouses in here. Clap it up, yes, because it is a family affair. It's a big deal. And then our daughters who are the joy of my life, Ava and Aaliyah. Ava's 5, Aaliyah's almost 3, she likes to tell me. So they are amazing, and they believe that Inspire Primary Care is their business. And they ask me, how are our patients doing? And I let them know, I report, okay? And then on the right, that's what the whole DPC doc thing looks like. I'm often in the white coat with the laptop and the cell phone and enjoying the balance between these things. To really transition into the tools that we'll talk about that have helped with balancing DPC and home life, I'd have to start with sharing a little bit about my journey and how the transition from residency into DPC looked. And so I always like to pay homage to baby Jade, okay? That's the one over on the right or on the left. That's at 4 years old when I first started saying, I want to be a doctor when I grow up. Everyone would ask this 4-year-old, what do you want to do when you get older? I want to be a doctor. And because I had a pediatrician at the time who had a private practice, I used to tell people, and I want my own practice, because that's what I had saw. People thought that was a cute dream, and then here comes med school, and I graduate medical school, and I'm like, yes, I'm so excited. I am going to be a doctor, and I really want to take high-quality care of patients. Baby Jade still had that thought. Med school Jade still had the dream of baby Jade, which was I'll be able to provide really high quality care. I'll be able to be the doctor that my patients know in the community that can reach me. And then came resident Jade, okay? She's at the top middle, and that was my first day of residency, and I was like, okay, I've matched to my #1 at Loma Linda in California. It's lifestyle and preventive focused. I'll really be able to make a difference, especially with wellness and lifestyle medicine. So here comes intern year. We get pregnant with Ava. That's very interesting, balancing that. And then 3rd year of residency, well, I'll start with 2nd year of residency is when I heard from an attending. She asked me, what do you want to do after training? And I told her the dream of baby Jade. I want to be able to take care of my patients, be accessible, all the things that she was not experiencing as an attending. And she said, well, maybe you're interested in something called direct primary care. I had never heard of that. I began researching it, began attending the conferences. At the time, it was the pandemic, so I attended them virtually on night shifts while my co-residents are sleeping. And I learned everything there was to learn about direct primary care. Shared it with my husband, Carlos, and I said, can we do this straight from residency? Can I skip the whole contract physician thing? And over time, he said, let's do it. Let's do it. I think it's a great fit for our family. 3rd year of residency, we're pregnant with Aaliyah. I graduate 8 months pregnant. We have the baby. We have the baby. I have the baby. All right. And then 8 weeks later, we open the doors to Inspire Primary Care. So at the top, there's me with the scissors at our ribbon cutting, and Carlos is holding our 8-week-old Aaliyah, and our 2-year-old at the time, Ava, is running around. And what everyone sees now today on the right is Dr. Jade MD on socials, right? Where it's like, wow, you look like you're really enjoying being a doctor and balancing your life. And the things I'll share next is what has helped this actually to be a reality, and that baby Jade's dream is now come true. So DPC has given me several things, okay? DPC has given me joy. DPC has given me autonomy. It's given me balance, and I'm able to prioritize my wellness, which is very important to me. It's given me convenience and freedom and flexibility. So how? So I'm gonna go over 10 tips for creating the DPC practice that you love. Here we go. So number one is verbalizing your values. And this may seem like, okay, well, that doesn't really tell me how to balance DPC, but this is the foundation. We're gonna start with the foundation and then we're gonna build from there. Verbalizing what you value, and I'm sharing my top 3 values and yours may be completely different, but what do you value? Because from there, we'll be able to craft our direct primary care around those values. So for me, my time with God is the number one thing that's most important to me. If I'm not spending time with God, I'm not my best self. So that's one of my top values. Number 2 is my self-care. I'm one of these crazy docs that thinks it's important to pour into themselves and then serve others from the overflow. So prioritizing my self-care is really important to me. And then my third value is time with my family. If I'm not spending quality time with Carlos and Ava and Aaliyah and the rest of my family, we're a tight-knit family that you see in the picture, then I'm also not my best self. So that's first thing. Number 2 is what is your why? Now, every now and then, I'm gonna make this a little interactive, okay? So raise your hand, have you read the book Start With Why? Has anyone read it? Okay, yeah, I see several hands out there. When I first joined or told people that I wanted to start my entrepreneurship journey and do DPC, several people that were in entrepreneurship told me, oh, you've got to read the book Start With Why by Simon Sinek. And I'm so glad that I did because it really also laid a groundwork foundation of why are you doing this? Why aren't you just going to get the employed position? And the why is important as we open the practice and grow the practice because I have to refer back to the why when there are hard days, because although there's many rainbows and butterflies in DPC, there are hard days. So my why in Inspire Primary Care and in DPC is providing quality healthcare to our members and helping my patients transition to a healthier lifestyle, a healthier weight, helping them to prevent and reverse chronic disease. That is my why with Inspire Primary Care. So as we grow and scale our practice, and when people come to me and say, you should add this to your practice, you should add this stream of revenue, I think to myself, well, is this gonna help us provide quality healthcare to our members? Is this gonna help my patients transition to a healthier lifestyle, a healthier weight, and prevent or reverse chronic disease? And if the answer is no, then we're not adding that as we grow and scale. So what is your why? These are mine, but it's important for us to reflect on that as we go deeper. All right, number 3, this I love, and that is applying automations. So the first year of our practice, I did some moonlighting at urgent care while our patient panel grew, and then I ran the practice as a one-woman show. I was truly a micro practice at the time, and many people would ask me, how are you doing all these things being the only doctor, no team, no staff? How is this happening? And I would tell them, me and automations. I've shared some of my top 3 automations that I really love, but at the time I didn't need team, I needed automations. And so some of my favorites, my scheduling through Calendly. I'm not getting anything by mentioning these, but I like to share the actual things that have helped me. So Calendly, I'm not going back and forth. What time do you want to meet? Maybe that works for me. Let me check my schedule. Let me check your schedule. No, here's the link. I've already set all the things, the times that I'm available. Self-schedule when you're ready. So the scheduling was automated. My website had everything automated for enrollment, hence for my billing, which happens to be my EMR, made the practice management automated. Spruce, I love for text, and now that we do have a team working together and sending each other messages through that system, also helps everything flow as a system. Number 4 is strategic outsourcing. I'm gonna sit in this one for a minute because I love outsourcing. There's 2 ways I divide this. First, on the practice side, on the business side, and then second, on the home side. So let's talk about the practice side first. When it comes to outsourcing, there are certain aspects, and with this whole outsourcing idea, it's what things do I need to be 5-star, set, ready to go, top tier, but I don't necessarily want to be the one who does it. I'm gonna pay somebody else who is an expert in that, and that's their zone of genius, to do that for me, okay? So the things I outsourced for the practice, one, I talked about my website. I said when people Google me and go to my website, I needed to look lavish. I needed to look like they are about to be getting the best physician experience they can get. It needs to reflect what they're gonna be getting once they hit that enroll button, okay? So that I outsourced to an amazing website designer. Next was bookkeeper. When tax season came around, I wasn't gonna be trying to figure out QuickBooks. It's great if that's what you wanna do, but I'm talking about the things I needed to outsource. So we got a quality bookkeeper. We outsourced that. And now I've graduated to outsourcing my social media content through our marketing assistant, and that has been so nice to outsource. On the personal side, those things need to be outsourced too, okay, to make things run smoothly. Cleaning, I don't know about you, but there is no better feeling than coming home to a clean house that I didn't clean. Is it just me? Is it just me? Oh, okay. Woo! I'm glad I'm not alone, okay, because that is something I'm outsourcing, all right? You're not gonna see me dusting and mopping and sweeping. My daughter, okay, my husband Carlos is gonna laugh. She saw a vacuum in the house and she said, oh, that's the thing Daddy uses, because I'm not doing it, but I need my house to be spick and span, okay? We're outsourcing that. The next thing is meal planning. I happen to love cooking, but what I do not love is, what do you want this week? Do you want salmon? Do you want chicken? Do you want me to saute it? Do you want me to bake it? No, the meal planning is obnoxious for me, but I like to cook. So we outsource. The box come into my house. It gets delivered every Friday. It has the ingredients. I take it out the bag, and I cook it. So we outsource the meal planning. Laundry, okay? It was piling up. It was annoying to fold and put away. So I hired this amazing person called my mom, and I pay her to fold and put away our laundry, okay? So these are things I outsourced, and luckily she's really cheap labor, so I appreciate that too. So outsourcing does not have to mean expensive, okay? So number 5 is profitable pricing. Okay, I'm stepping into it, all right? We're talking about price and DPC. It's gonna be okay. But this is really a topic that I'm not sure why it's so uncomfortable to talk about. We are growing businesses. We are growing, if you're an LLC or an S Corp, et cetera, it's not a 501c3, we're growing businesses. And it's okay to provide really high quality care and also wanna be a profitable business that doesn't require the physician to have so many moonlighting gigs or doesn't allow us to close our doors because we couldn't make a living, okay? So I'm big on profitable pricing. This has to be sustainable. This might be region specific, okay? What we charge in the Midwest may not look the same as on the coast. This may be ideal member dependent, okay? If you are called to serve primarily blue collar workers, that pricing may look different if you're called to serve executives in New York or in LA. And what I've found to be helpful in our practice is having membership tiers. This allows people to have access to our care and then allow us to build more premium access within our memberships on a membership tier. So that's what it's looked like in our practice with our primary care membership or upgrading to our medical weight loss membership. So 6 is methodical marketing. So marketing is a fun topic in DPC. I already met a few docs that were like, I don't want to sell anything. I don't want to talk. I don't want to go on social media. And I get it. But now that I see how lives are transformed by working with us in Inspire Primary Care, I'm just sharing the good news, all right? And if it's for you or someone you know, you'll get it and you'll join. And if it's not for you and you don't mind the 3 to 6 months waits in Las Vegas and having to go to the urgent care and all the other joys of going to an insurance-based practice, then that model is there for you too. You have that freedom to choose. But we're gonna market. Now, I will say, the first year of our business, it was like throwing paint against the wall. We tried this, we tried that, we tried this, we tried that. But then at the end of that year, we looked at the data and we said, okay, what are the top 3 things that we did that actually brought in our ideal members? Now let's dump all the other forms of marketing and go all in on those 3 things. So that's where we're at now. For us, that was social media. About 40% of our practice joined by first following us on Instagram, all right? So shout out to the gram. Social media has been great for us. So we came and we put together a really high quality social media strategy. Number 2 is networking, all right? Strategic networking. You won't see me at every networking event in the community because I've got a 5 and a 3-year-old. However, you will see me in rooms filled with my ideal members or my ideal referral partners. So strategic networking has been really important. And then last has been, of course, that word of mouth. That's where 60% of our members came from, by either a friend or a current member or an employer, and seeing the reviews on Google. I lump all of that into word of mouth, okay? So methodical marketing, very important. Once we get that system, we can really just let it go on autopilot from there. 7, Phil gave a little sneak peek that we'd be chatting about this. I love talking about boundaries. I don't know why some people don't. To me, every healthy relationship requires healthy boundaries. I know what to say to Carlos and what lines not to cross, and vice versa. We have boundaries in our marriage. In my friendships, I have boundaries. With my patients and in our practice, we do as well. So some of our boundaries, my boundaries may look different from your boundaries in your DPC, but some of ours are business hours. People love to say, oh, perfect. Are you 24/7, doc? No, we have business hours, okay? However, we have Monday through Friday, 8 a.m. to 5 p.m. direct physician access. I don't know about you, but that sounds like a whole lot of access to me. So after hours and weekends are for me and my family, all right? So business hours are one of our boundaries. Membership only is one of our boundaries. You may choose to do one-off services, but our boundary at Inspire Primary Care is we are a membership practice. So when people come and they say, well, I just go to the doctor like once a year for my physical, can you just give me the price of that? I let them know you can surely pay for the annual membership if you don't want it to come out monthly, but we are a membership practice, monthly or annual. And that's one of our boundaries. The other one is enforcing our member agreement. We spent lots of time building out a beautiful membership agreement, and so we just refer back to it. When people ask for things that are outside of our boundary, we just refer to the membership agreement. Oh, you left the practice and you want to rejoin? Do you have to pay the re-enrollment fee? Oh yeah, it says it right there on your agreement. We don't have to play around and think about where the boundaries lie. It is crystal clear, and it makes for a really healthy patient-physician relationship. Number 8, I love this almost as much as I love outsourcing, okay? That is deliberate delegating. I like to think of myself as Oprah these days, minus the billionaire status so far, and that is you get a task, and you get a task, and you get a task. If you know me and you're close to me, you're probably gonna get a task because I need to delegate. I'm one person and I can't do it all. I think I've transitioned on the spectrum from being the person who thought I had to do everything and it'll only be perfect, it'll only be done right if I do it, all the way to the other side of the spectrum where I'm like, you can do it, I'll show you how, all right? Teach one, what do we say? Teach one, you get it. You know what we say in medicine, yes. I'm gonna show you, then you try, you got it, perfect. And then I oversee from there. So on the practice side, I break this into practice and home as well. On the practice side, I'm delegating to our practice assistant. We have an amazing practice assistant. I have trained her up to basically do every skill in the practice that does not require the physician. When I think of a task in the practice, I say, does this task have to be done by me? Does it have to be done by me? And if the answer is no, then I'm delegating that. We're a team. So all non-physician required tasks in the practice, delegated to our practice assistant. My husband, pray for him, he wears many hats. He is our COO of our practice. He runs the operations side of the practice. So if something falls under the branch of operations, I send that email right over to him. He's processing the payroll. He's making sure our licenses are up to date. He's doing all of the things that are on the operations and tech side of the practice. Delegate that right over there. And then we have our content assisting. I told you the marketing branch is so important, and it became a part-time job to keep up with all the marketing, so we were able to bring onto the team a really high-quality content assisting. So all of the posting and the graphics and the marketing, that's over there in our marketing assistant, all right? So that's on the practice side. On the home side, love to delegate there too. Again, I told you, pray for my husband, Carlos, so I'm delegating as much as I can to him, and don't worry, he's delegating to me too, we're a team. And then I delegate to my parents. I already told you about laundry, but when we need those date nights, et cetera, we're delegating some things to them. And in my house, if you can walk and you can talk, you can help, okay? So I am delegating to our children too. And I think it's some great leadership, some skills that they're learning on all the things around the house that they can help mommy do, okay? So we are delegating, and we're doing it deliberately, and that's really helpful. And number 9, we're almost there, we got 10. Number 9 is a structured system. Here we go, back with the participation. Has anybody read this book called What the Heck is EOS? Oh, I got a strong hand raised over there. Couple in the middle. All right. It's important, especially as we grow and scale, to have a really structured system in our practice. A friend of mine who has a very successful company in our community told me, oh, you've got to read this book. It is life-changing. And it has been. There may be others, but the EOS, which is an entrepreneurial operating system, we integrated it into our practice, and it has been a game changer for us. It has really helped things to run like a well-oiled machine. And a part of that was us also creating standardized operating procedures. And so each main procedure, or each main role in our business, has standard operating procedures. For example, with our practice assistant, she has built out a whole standardized operating procedures with videos, and it's a whole thing. So when we bring on additional in the future, it is a smooth onboarding process, okay? So creating a structured system has also been so important as we make the DPC complement our home. And number 10, this one I love, and that is building the business around your life. Building the business around your life, because although my patients have membership access Monday through Friday, 8 to 5, I am not at the practice Monday through Friday, 8 to 5. I'm able to customize my hours to build it around my lifestyle. So I'm very transparent. In this season, I'm in the clinic Tuesday, Wednesday, Thursday, 10 a.m. to 3 p.m., okay? Those are my clinic hours. On Monday, I like to call it my admin day. We're a homeschooling family with Ava just transitioned into kindergarten, so we're homeschooling her. So I do a mix of admin and answering lab work, of course still answering those texts and emails and things like that, but I'm also homeschooling on that day. On Fridays, I'm a homeschool mom too, which is really fun for me. I got graduated to teach her Spanish, so that's been really fun to help build a curriculum around her homeschooling curriculum. And we're also very involved in ministry. My husband's also a pastor, so we're very involved in our church. I'm very involved with my self-care. I'm getting that workout in the morning. I love fitness. We're a pickleball family, so we're gonna do that a few days a week. I'm dropping the kids to ballet and gymnastics. We're creating memories, and that is really, really important to me, while providing high quality, high access primary care to our members. And that has been so, so rewarding. So I told you at the beginning that DPC has given me joy, autonomy, balance, wellness, convenience, freedom, and flexibility. And the secret sauce to that has been knowing my values and my why, having boundaries and delegating, having systems and automations, having profitable pricing and outsourcing, having strategic marketing, and building the DPC practice around my life. So this has allowed me to have joy throughout the journey. The doctor in the middle, providing that high quality care, but also creating such sweet memories with our family along the way. So keep in touch. I hope you enjoyed this. I hope this was helpful. I am on just about every social media platform. Instagram is our main social media platform. I'm at Dr. Jade MD. The practice is at inspireprimarycare.com. We spell inspire without the I in the front just to be fancy. All right, you can email me. Many doctors ask me more questions after I do these talks on, can you tell me more about how you built your practice primarily from Instagram and social media. So I have put all the physician questions I get into a PDF. If you email me and just request the PDF, I'm info@inspireinc.com. If you email me and you want to learn how to do that, I'm happy to share that PDF with you. I get a lot of questions on that. I do have a podcast called the She Inspires Podcast. It is the space where busy women talk about balancing business and wellness. So we talk about lots of these type of topics there on the podcast. If you know any friends that are moving into the amazing city of Las Vegas, lots of people moving in, send them our way at Inspire Primary Care. We'd love to care for them. And thank you so much again for having me today.